Let's talk about where we are today. First, on the facts first, total number of hospitalizations is down. That's good news. The rolling average of hospitalizations is down. That's good news. The intubations are down. And the new cases are up a little bit on the rolling average, but all part of the decline. So that's all good news. Number of deaths ticked up, which is terrible news, but the overall line is still good. And the 109 families that lost a loved one, they are in our thoughts and prayers. What does a governor do on Memorial Day weekend? People ask me all the time, what do you do? So what does a governor do on Memorial Day weekend? You go to the beach. That's what a governor does. And he brings his friends. And I'm here with my friends today from the far right, Gareth Rhodes, to my immediate right, Melissa DeRosa, Secretary to the Governor, to my left, Robert Mahica, Budget Director for the great state of New York, and Dr. Jim Malatras, who is not a real doctor, but he likes to be called doctor. So we're at the beach. Beaches in New York State, state beaches are open. Jones Beach, the Sunken Meadow Beach, Hither Hills, Robert Moses Beach. Campgrounds, RV parks open tomorrow, and we're excited about that. We remind all New Yorkers to be smart in what they're doing. We're now decidedly in the reopening phase, and we've been following the numbers from day one, not emotions, following the science, not the politics. This is not a political ideology question. This is a public health question. It's about a disease, stopping the spread of the disease, and that's science. It's not politics. We have all the numbers posted for all regions in the state. We want people to understand the numbers. We want people to understand what's going on because it's their actions that determine our future. So informing the people of the state, that's what I've done from day one, every day, and that's what we'll continue to do. Also, we feel that this is a case of first impression. We've never been here before. We've never been here before in our lifetimes. That's true. But the country has been through this before, and you learn from the past so you don't make the same mistakes. When we went through this in the 1918 pandemic, you go back and you look at the places that opened in an uncontrolled way, and you see that the virus came back and came back with a fury. So this is not, again, it's not about what you think, ideology. This is what we know. These are facts. You go back and you look at what happened in the 1918 pandemic in St. Louis. Go look at Denver, where they loosened up too quickly and the virus came back. Article in the paper today, the Washington Post, 24 states may have an uncontrolled growth of the virus. They're talking about California and Florida may still see a spike in the number of deaths, okay? Those are all facts, and they reinforce the point that we've been making. Follow the numbers, follow the science. And we have done just that. That's why you see our curve is coming down, where many places in the country the curve is going up. Remember, what happened to us was no fault of our own. Actually, it makes the point, because what happened to us was we did not have the facts when this started. Everybody said the facts were the virus was coming from China. Those were not the facts. The virus had left China. The virus went to Europe, and nobody told us. And people came from Europe to New York and to New Jersey and to Connecticut. And 3 million European travelers came, January, February, March, before we did the European travel ban. And they brought the virus to New York, and that's why the New York number was so high. We didn't have the facts. We were not informed. But once we got past that and we were in control, we have been smart. And smart has worked. We just have to stay smart. Even though It's been a long time and people are anxious. We have to stay smart. You keep watching those numbers. The Mid-Hudson is still on track on the numbers to open Tuesday. Long Island is on track to meet the numbers on Wednesday. We have to get the number of deaths down on Long Island, and we have to get the number of tracers up, but we're doing that. We're preparing for Long Island to open. We're getting the transportation system ready. It's run, the Long Island Railroad is run by the MTA. They're going to be cleaning and disinfecting all trains and buses every day. First time ever. We never disinfected buses and trains before. We never thought we had to, but we get it now, and they're doing it every day. They're going to add more cars to the trains so people can space out and socially distance when Long Island opens. I want people to remember that a mask is mandatory on public transportation. I think you're making a mistake, a grave mistake, if you don't use a mask in your own personal life. We know that it works. We know that the first responders have a lower infection rate than the general population because they wore the masks. So I think if you don't wear the mask in your personal comings and goings, you're making a mistake. But I do know, as governor, if you're going to subject other people in the public to your behavior, then you have to wear a mask when you can't socially distance, and that's true on public transportation.
After the spaces are taken up by the I'm just wondering, when the weather this week gets warmer and warmer and we start getting crowds of people with quarantine fatigue looking for some relief coming here, are they going to find that there's no place to park and that they just took an hour trip for nothing and they're going to go back home with their car full?
Well, your observation should be technically correct. There should be orange cones in half the number of spots because we said 50% capacity is now a max. That's to make sure that we have social distancing on the beach. We can do social distancing on the beach because we're at 50% of max. We have not reached 50% of max, so no one has been turned away. But as the weather gets warmer, I expect more people will come. And the reopening of the economy is going to be across the board, right? We start gradually, we start slowly. We make sure we're all being smart so the virus infection rate stays down, and then we continue to reopen.
Based on what he said, as the summer goes on, would it be a possibility of maybe having odd number of license plates or even on certain days?
Look, if you get to that point, you could. But if we remain smart, you can increase economic activity without necessarily increasing the viral spread. Okay? This is a perfect scenario. People start to come out, more people are coming out, but they're all doing it smart. They're wearing the PPE, they're staying away from each other, they're using the hand sanitizer, and the virus infection rate doesn't go up, or it goes up a little bit. As long as you're controlling that virus infection rate, then keep continuing opening. And that's why I keep hammering the smart part of this. If you are wearing the mask and you're doing the hand sanitizer, you could increase your activity and not infect anyone. And that's what we have been doing so far. But what does next week look like? Next week is a function of what we do today. Oh, that sounds too glib. That is factually true. You tell me how people act today, I will tell you the infection rate 3 days from today. So, you want to open faster? Be smart. And we'll just calibrate it to the infection spread. What you're protecting against is what they're talking about for those other states. That infection rate goes up, number of deaths goes up, you overwhelm the hospitals again. That's what we're protecting against. But if we stay smart, and we have been smart, you look at our numbers compared to other states, there's a dramatic difference on what's going on because we've been hammering the smart. Stay smart, watch the numbers, and I'll tell you what happens next week when we see what people do today, and if those numbers stay down, then just keep increasing the economic activity. Let's do one more. We don't have one more?
Oh, I'm sorry. Question is about the COVID testing.
You like getting the last question, I've noticed.
I like getting it first.
Yeah, do you like first? First or last, I think is good. You don't want to be stuck in the middle of it.
Well, the question I have for you is about testing. Some people are reporting that when they go for a test, which you say anybody can get, they get the third degree, and so they get prioritized. Is that what you want happening, or should anyone who wants one get one easily?
You get prioritized, and you get the third degree. You get prioritized because what we, all of us, want is the most likely people infected the fastest, right? So if you're showing symptoms, go to the front of the line. If you know you were in contact with a COVID positive person, go to the front of the line, because we're really worried about you. And if you're infected, I don't want any delay. I want you to know right now so you can isolate and we can start the contact tracing. Third degree, yeah, we want to know where you were, what makes you think you were infected, how old you are, because getting that data is very helpful to us. We're now focusing on where the cases are coming from. And where do you live? I live in Nassau. Where in Nassau? What community? Are you an essential worker? Have you been working? Yes or no? Just to give us data. It's all private, but we want to get the data so we know where is the infection coming from, so we can really, like a laser beam, focus on those areas.
What if someone's being denied, or saying, no, not you, not yet?
That's not the situation we're in. We have extra capacity. We have drive-ins. I just passed one. We can do 15,000 tests a day. We're only doing 5,000 tests a day. So it's not that we're at a capacity level. We have more capacity for the public than we are now using. And that's why I keep encouraging people to come out. But yes, there's a prioritization. If I think you're positive, and there's a likelihood you're positive, I want to get you tested by 1 p.m. So you're isolated at 1:20, and you don't infect anyone else, right? It's all about keeping that infection spread number down. All right? Let's enjoy Memorial Day weekend. Thank you all very much for taking the time. Thank you.